More than 80% of women experience hot flashes during menopause. We know that the sudden feelings of intense heat, sweating, and flushing of the skin are not uncommon at all. They're like the unexpected thunderstorms on a summer day. Just when you think everything is calm and clear, a sudden surge of lightning and thunder rolls in and disrupts your plans. Hot flashes during menopause are unpredictable. They can occur suddenly and without warning, making them difficult to anticipate and control. Now, let's throw running into that equation. Trying to run during a hot flash is like trying to find your way through a maze that has magical shifting walls. Just when you think you found your way, a wave of heat hits, disorientating and distracting you from your path and making it really difficult to stay on course. In this video, I'm going to show you how to navigate the shifting wall maze while battling it out with a sudden thunderstorm. We are going to discover how they're affecting your running and if there is a risk factor to consider. And of course, I'm going to tell you what you exactly need to do if you experience a hot flash on a run. So, before we get into the nitty-gritty of how to dominate hot flashes on your runs, we first need to fully understand what exactly a hot flash is. Hot flashes are most commonly seen in females going through menopause. Of course, there can be other instances where people are going through other hormonal changes or different uses of medication, and even though not as common, some men can also experience hot flashes. Hot flashes or hot flushes, both terms are used interchangeably and is known as this intense heat wave that comes over neck, face, chest generally and cause sweating and rapid heart rates. As we know, through menopause, estrogen levels are fluctuating and eventually flatline. The changes in estrogen are considered to be the reason for these hot flashes. However, we actually don't understand the mechanism of hot flashes completely. I am going to touch on some of the physiology of that in just a little bit. The effect of hot flashes is never a blanket approach. They vary in intensity and frequency across the board, and so everyone would have a very individual experience. Some females are lucky enough to not even experience them through their menopausal transition. We know that hot flashes disrupt sleep, disrupt general daily activities, and of course will disrupt your running. And we are going to dive into some treatment options and how to deal with hot flashes a little bit later in this video. Here's a shocking stat for you. 75% of menopausal females report experiencing hot flashes while they are trying to sleep. Of course, this leads to increased fatigue and decreased quality of life and training. So before we dive into some of the treatment options, let's look at the physiology of what a hot flash is. Essentially, the changes in estrogen through your menopause transition affect the thermoregulation of your hypothalamus. Those are all very big words. The hypothalamus is the center in the part of your brain that controls your thermoregulation. So it's like your internal thermostat, if you want to think about it that way. And as we're going through these changes, or the changes of estrogen fluctuating, cause little mini changes within your core temperature. What happens then is that your brain picks up on these small little changes in your core temperature, but they're not actually happening. And as a result, will send a signal for your body to react to that. So there is the increased sweating and heat flash that comes over, and that is because the body is, or the brain thinks that the body needs to cool down, and so it does its normal response when the body doesn't actually have to cool down, and therefore there is a hot flash. You may be feeling slightly hopeless now and probably thinking, oh, well, great, Shona, thanks for all that positivity, but I assure you, it's not all doom and gloom. There are strategies that you can implement to overcome these hurdles, and I will share each and every one of them with you. But first, we have to take your running into consideration, and more importantly, how your hot flashes are affecting your performance. The biggest impact on your performance is that there is a lack of sleep. Hot flashes occur at night very often. Even if you don't realize it and you're not actually waking up, you can still get affected and it affects your quality of sleep. We know that sleep is vitally important for your recovery from running. And so if you're having this disrupted sleep, it's going to affect how you recover and therefore how much you improve in your running. It's also going to give you feelings of fatigue and tiredness, which has a knock-on effect on your following sessions as well. And then of course there's the obvious point of experiencing a hot flash on a run. The general feelings of uncomfortableness while you are running, you're not feeling comfortable in your own skin, not recognizing who you are because these things are happening so haphazardly. If you're so routine based and are used to just getting out and going running and not having anything knocking you off course, this can have an effect on your routine. But here's what you can do. I'll first discuss general solutions, and then we'll get into what runners specifically can do to overcome all these different hurdles of hot flashes. The most used and widely reviewed treatment option is menopause hormonal therapy. It is shown to significantly reduce the severity and the intensity of hot flashes and night sweats. Unfortunately though, not every single female is a candidate for menopause hormonal therapy, and so it can never just be this blanket approach. Please speak to your physician to see if you are, because it is very, very helpful if you can be a candidate for MHT. The feelings of fatigue and tiredness from a hot flash or a night sweat and how that affects your everyday life, let's try to tackle some of that. Some advice there would be to try and get an extra nap in the day if you can. That sounds like a great pipe dream. But then to perhaps also try to get to bed a little bit earlier, just to make up for a little bit of lack of sleep where you can. That will also help your recovery all round. Next, let's talk about sleep hygiene. Hot flashes, as I mentioned, really can occur quite often at night, affecting your sleep. And so we want to make sure that we are getting our bedroom right, trying to control our controllables. So you want to ensure that your bedroom is nice and dark, no light coming in. And if you do have light coming in, I highly recommend getting one of those eye patches. You want your bedroom to be nice and cool as well. The general recommendation for this is around 18 degrees Celsius. And so you're keeping that room nice and cool. If you need to use a fan or an aircon, that's ideal. And I know that this point is really difficult to control, but try and stay off your cell phone, your laptop, and the TV late at night before you go to bed. Anything that emits light will have a hormonal change in your melatonin, which will affect your quality of sleep. So let's control our controllables. Next one we want to tackle is our nutrition. While this is not an absolute cause and effect option in the science, it is somewhat shown that good changes in your nutrition can help managing these hot flashes. Try and stay away from high inflammatory foods, keep a balanced diet, cut all processed foods out, and definitely staying away from alcohol, because that will disrupt your sleep. And then from a training perspective, it's really important to watch that you're not overtraining. Overtraining causes a disruption in hormones as it is, and we don't want to exacerbate our already disrupted hormones through menopause with overtraining. Now, for runners, there's no risk to running through hot flashes, but as you'll know, they are extremely disruptive and quite annoying, right? So I highly recommend that you run with light layers. If you're getting cold, you can always zip that up, and if you're getting hot, you can take it off and tie it around your waist. Another tip is to stay hydrated. Keep fueling with some water, preferably ice water, because that'll get the core temperature down as well. And then keep your easy runs very easy. Use your walk breaks to help you when you are experiencing a hot flash. Walk that out so that then you're keeping that run nice and easy. Exercise is good for overall health and well-being. It also helps maintain a healthy weight, which has been shown to lower the incidence of hot flashes. Doesn't prevent it, unfortunately, but it definitely does help lower them. It's all good and well knowing how to navigate hot flashes through your training, but if menopause runners did this, they'd be 10 times better off.